My name is Courtney, and I decided to do my teaching project on code documentation in Epic. So I chose this topic because I'm on a rehab floor, and a lot of our patients are going home, so we don't really have high acuity for them necessarily, but we have had a few instances where rapid responses were required, so that they could get higher level of care. So I got to experience this as a new grad at the end of March by myself, my first one. And it needs to be taught, definitely, to new grads. And the new grad training programs are prioritizing code documentation for us to teach us how to do it. And so many of my colleagues are unfamiliar with the process and don't know how to correctly document during a code. So I chose this to improve awareness and ensure that my team understands the documentation process and make sure that we follow protocol and maintain accurate records for our patients. So I went over the types of codes. There's a lot of codes in the hospital, but red, code blue, yellow, orange, every color. But the main ones are code blue, which is cardiac arrest. And then I talked about the types of rapid responses, such as chest pain RIT, stroke RIT, and sepsis RIT. And a big thing for us is people don't know how to call them correctly on my floor. So we have to make sure we call 911 on the hospital phone, not our cell phone. And then maintain vital signs, put the oxygen on, tell the doctor that there's a patient status change, and have the chart open and ready so when the code team gets there, you're ready. Because I was a little panicked, but I was good. It was fine. But I was a little stressed. So on my PowerPoint, I have screenshots of our, it's called Epic Playground, which is it's like a training way to use Epic for people who are learning it. And so you can do basically a fake code or a fake RRT just to practice. So like when the real thing happens, you're ready to go. So in my PowerPoint, I described how to get there and the importance of the documentation. And you can document their medications you give, vitals. You can add any kind of assessment. You can add IVs. You can add airways, all from one page. So it makes it really easy so you don't have to keep going through the chart, trying to find what you gave and when and orders. It's all in the same tab, which makes it really nice for us because it's kind of chaotic already. And then trying to shuffle through a chart is a little stressful. So the chart that I picked, or the tab, has vitals in the middle, and then it has medications on the left, and stuff like assessments and stuff on the right that you can add. And it basically puts it all in a time log, everything you did and what time, so that way you have accurate documentation of when you did stuff, and medications you gave. And you can put the doctor's orders in from the same tab, and it automatically puts the orders in. And then when the code is over, then you just hit end code, and it saves the log. Every time you get on the code documentation, it shows the past code. So it stays there, and it's in the chart. So you don't have to go back and rechart everything that happened. You can also order meds, and you can order labs from the same tab. So I chose this as my leadership because it's critical for nursing. And it's very important for our nurse leaders, like our charge nurses, play a vital role because they're the ones that we go to when we're in high pressure situation. And it's just easier to have all the information all in the same space. And that way it's clear communication among the team members and physicians. And it's recorded in real time so we can go back and find it. So strong leadership during critical situations is very good. And I am glad that I had a charge nurse with me because it was my first one. But it definitely reduces the errors and anything that could impact the patient negatively or the hospital negatively through legal considerations. And then we're able to safeguard the integrity of the medical record and the patient. So I did have a slideshow that I will post too that kind of explains it more nicely, I guess, because there's pictures. But yes, this is why I chose code documentation.